You can see the thoracic cage will be formed of sternum, then we have the ribs, and we have the vertebral column, which will be having the thoracic vertebra. The thoracic cage will be having inlet and outlet. Inlet and outlet. We already discussed about the inlet, and the outlet will be formed by the costal margin. Costal margin. Okay, so we need to go through first the ribs, then we have the vertebra, and then we go through the sternum. For the ribs, there are two classifications of the ribs. So first we have 12 ribs on each side, so total will be 24. You can see that the ribs, they come out from the vertebral column and they are inserted here into the costal cartilages. And then the costal cartilages, they are inserted into the sternum. Not all the ribs reach the sternum. The first 7 only. From number 8 up to 12, they are inserted into costal cartilage, and then the costal cartilage, they will form the costal margin, which will be inserted later on into the sternum. So that's why they classify the ribs into true ribs. The true ribs, the one which reach the sternum directly. The false rib will be the rib which does not reach the sternum, which will be from number 8 up to 12. The last two ribs, which you can see it here, rib number 11 and 12, those will be the floating ribs. The floating ribs, they will be having pointing anterior ends, and they does not reach the costal margin. Okay, they are considered also false ribs. And we have also typical rib and atypical rib. Okay, so the scientists, the anatomy scientists, they come together and they decide to put like typical features for a rib, and the one rib who does not go with these features, we call it atypical. So the typical rib is supposed to have anterior end, posterior end, and shaft, and the posterior end will be having, you can see here, the head, which will be having two facets. Then we have the neck, and then we have the tubercle. Okay, and then we have the tubercle. And if you look, you can see that there is an outer surface and inner surface. And if you look at the inner surface, you can see a groove, which we call the costal groove, which will be for the neurovascular bundle, which will be the intercostal vein, artery, and nerves, which will be supplying the chest wall. So any ribs which doesn't follow those features, we call atypical rib. So basically you can see here, from the rib 3 to 9, this one are typical. But rib 1, 2, 10, 11, and 12, which are atypical rib. Okay? We need to know why they are atypical rib. First we go by the first rib. You can see here it doesn't go along with the criteria I mentioned before. Why? First you can see that it has only one facet, okay, and it doesn't have any costal groove, and it's very short and thick, okay, and it doesn't have outer surface and inner surface. No, it has superior surface and inferior surface. Okay, for the first rib, very important. They will be the most common asked in this pose. Okay, the first rib, we need first to know the features. So we have also head, neck, and tubercle, and we have anterior end. Then we have the shaft, which has outer border, inner border, and superior surface and inferior surface. How to know right from left? First to do is that the rib must be convex outward, right? That's the first one. Number 2, the anterior end and the posterior end. So the posterior end, which will be having the head and the facet. And finally, the superior surface and inferior surface. The superior surface will be rough because it provides attachment to many muscles. Okay, you can see here this tubercle in red, called a scalene tubercle, attachment to scanus anterior muscle. In front of the scalene tubercle, there will be the subclavian vein, and then behind it will be subclavian artery. Subclavian vein, subclavian artery, and scanus anterior muscle. Relations to the neck of the rib. There are 4 structures which are passing in front of the neck of the rib. From medial to lateral, we call a chain pulling a vein. A chain pulling a vein. A chain which will be the vertebral chain or sympathetic chain, right? A vein which will be the vein, artery, and nerve. Okay, posterior intercostal vein, superior intercostal artery, and T1 spinal nerve. A chain pulling a vein. Those are the relations of the structure passing in front of the rib. The inner border will be attached to a membrane we call the suprapellular membrane. Suprapellular membrane comes out from the transverse process of the cervical vertebrae, and they are inserted here to the inner surface or inner border of the first rib. This membrane covers the bullura, so they tend to keep and preserve the lung. Suprapellular membrane. and the outer border they give attachment to serratus anterior muscle. Okay, so this is the first rib. There is an easy way to identify the first rib. You just put in anatomical position, means the anterior end anterior and posterior end posteriorly. Okay, once you see that it's already on the table, you can see that the two ends they are sitting on the table, so this one will be right. Let's try the other side. You can see that the posterior end is elevated upward, so it's not sitting straight. Okay, so this one is a right. Sometimes some people could say they can do it like this. Left, no. The anterior end must be anteriorly. Okay. So this one is the right first rib. The second rib, 10th rib, 11th rib, and 12th rib, they are different changes. The second rib, if you look here, you will find that it will be a little bit, not outer surface, inner surface. It will be a little bit oblique and smaller in size. And for the 10th rib, it will be having only one facet on the head. As if you can see here, you can see two facets. No, for the 10th rib, will be having only one. And for 11th and 10th, for 11th and 12th, basically they do not reach the sternum. Okay, and they will not be having any anterior end will not be broad like this. It will be tapered, and also it will be having will not be having any tubercle, and also neck.
This one is a typical rib.
This one typical. So 11 and 12, they don't have any neck and also tubercle or costal groove. So those are the difference between the ribs, how to memorize the ribs. So the question would come like this. Tell me this rib, type of this rib.
This is
Atypical.
true rib.
Once you said this sentence, which are two words, means you pass the five.
You have the 10 marks already.
Atypical.
Yeah.
True, false,
It's
typical.
atypical. This means you know everything. It's atypical true rib.
Like the confusion.
If everything, you know what is typical, what's atypical, what's true, what's false.
Then only we describe.
Then you can describe. This one is atypical true rib. Okay. Now for the vertebra. How many? So there is a joint here and there is a joint here. This joint, okay, this one will be primary cartilaginous joint. All those parts will be primary cartilaginous joint. Okay. For the first joint between the costal cartilage and the sternum, this one will be primary cartilaginous. Okay, but the rest are going to be plain synovial. Plain synovial. Why this one is primary cartilaginous? Because this one must be fixed. So the one doesn't move will be the first rib.
Only
The other ribs, they allow the movement, the mechanical movement of respiration. The chest how expand, and so all the joints here they move, but this one does not move. This one provides fixation of the thoracic inlet. They
and
cannot
clavicle
move.
and also
Huh?
clavicle can move. I mean,
Clavicle side of joint move, of course.
Only
You
specific-
can move your clavicle. But this one doesn't move. The first rib. The first chondrosternal junction. Chondrosternal joint. Okay, this one is primary cartilaginous and it does not move.
So the lines actually between the collar cartilage and the sternum are all primary cartilaginous. Also, all the
This one here, all